Hello all. Welcome back to another video tutorial. Today's topic is non-invasive intracranial pressure measurement. Why do we care about ICP? Let's start with the basics. Intracranial pressure, ICP, is the pressure inside your skull, where your brain and spinal fluid are. If this pressure gets too high, it can cause serious brain damage. That's why, in critical care, like in the ICU, doctors need to keep a close eye on ICP for certain patients, especially those with head injuries or brain diseases. What makes ICP monitoring tricky? Now, you might think, why can't we just measure it directly? Well, it's not so simple. The skull is a hard, protective shell. To measure ICP directly, doctors usually have to insert a sensor through the skull. This is called an invasive method. It's accurate, but it carries risks like infection and bleeding. That's why researchers and doctors are always looking for non-invasive ways to measure ICP, methods that don't require surgery or breaking the skull. What makes a good ICP monitoring method? Let's pause and think. If you were designing a perfect ICP monitor, what would you want? It should be quick and give results in real time. It should be accurate. Doctors need to trust the numbers. It should be safe and not risky for the patient. It should be easy to use and not too expensive. But here's the challenge. Every patient is different, and every situation is unique. Doctors have to weigh things like urgency, availability of equipment, and whether the method is appropriate for the patient. Here, I am going to explain about a non-invasive way of measuring ICP called constant frequency pulse phase locked loop, which measure tiny expansions of the skull that happen as ICP changes. Every time your heart beats, blood flows into your brain, causing very small, rhythmic expansions of the skull. By detecting and analyzing these expansions, we can infer changes in ICP without having to go inside the skull. This technology tracks these expansions in real time. It's more accurate and robust than previous non-invasive methods. It has improved bandwidth, meaning it can capture both slow and fast changes in pressure. With this approach, we can assess skull volume expansion, how much the skull expands with each pulse; total intracranial fluid changes, variations in the amount of fluid inside the skull; quasi-static ICP, the steady, baseline pressure inside the skull; pulsatile ICP increments, the pressure spikes that occur with each heartbeat. This gives doctors a much richer and more dynamic picture of what's happening inside the head. Benefits of this technology are based on known and well-understood principles, yielding data that demonstrate close correlation with a known non-invasive ICP monitoring technology, tympanic membrane displacement. Implementation of the technology would be straightforward and of low impact to the patient in a clinical setting. Applications are application of the technology to limited and narrowly defined settings, such as on-board emergency vehicles responding to medical emergencies and other medical triage situations outside of medical facilities, may present opportunities such as specific application subsets of ICP monitoring, as in remote, non-medical facilities and in emergency facilities, and equipment in which the product's likely low cost, small footprint and ease of use may constitute compelling advantages. Further refinement of the technology to yield ICP monitoring data more closely matching those of invasive procedures may be possible. Thank you for watching. See you soon with another interesting topic. Stay tuned.